Right, welcome again. Our first speaker for this morning is the Minister for Mental Health in New South Wales, the Honourable Rose Jackson. Rose Jackson is a Labor member of the New South Wales Legislative Council and Minister for Mental Health, Housing, Homelessness, Youth, Water and the North Coast. Rose was elected to the Legislative Council in May 2019 and has been fighting for real action on climate change and tackling homelessness and housing affordability, something that I'm sure we're all well aware of at the moment. Rose has also held a variety of roles within the Labor and Union movement, including Assistant Secretary of the New South Wales Labor and as an official of the United Voice, formerly the LHMU. Rose lives with her family in Rockdale and is passionate about making our society fairer for everyone. Please welcome to the lectern the Honourable Rose Jackson.
Thanks so much, Dave. It's lovely to be here with everyone. I'd like to start by acknowledging the traditional owners of the land on which we meet, the Gadigal people of the Eora Nation, and pay my respects to elders past, present and emerging, and extend that respect and acknowledgement to any Aboriginal people joining us here today. As has been said, my name's Rose. I'm the New South Wales Minister for Mental Health. I'd also like to start by acknowledging and thanking all of the people with lived experience and their carers who are joining us for this conversation today. I think that it is so incredibly important that these voices are given a prominent role in our political discussions when it comes to mental health. When I think about what is needed to make change in our society, facts are important. The truth is important, research is important, much love and respect to all of the researchers in the room. Your work is very important too. But really what makes change is people telling their stories. To me, that has been clearly evidenced as the most powerful pathway to actually change minds, to persuade people to do something differently. It's got to be backed up, of course, by the science and the evidence and the facts and the research, but people being willing to be brave enough to tell their stories and speak their truth is without question the most powerful thing we have as a society to tell a different story about whatever issue we're dealing with, and mental health is no different. So I really do want to acknowledge and thank those who participate in these discussions with courage and bravery to tell their stories, because that is the really powerful change agent that I think we have in this space. On behalf of the New South Wales Government, it's fantastic to be here at the Equally Well Symposium, and I know that everyone in this room has been working incredibly hard to address the inequalities people with mental illness face, and I want to thank you for that work and for that dedication. It is often incredibly challenging work. We know the statistics. The people who are experiencing mental illness have poorer physical health outcomes than the general population. They die younger, they're more likely to be hospitalised for preventable diseases. All of that is unacceptable. Everyone in this room knows the challenges and the barriers that people with mental illness face in accessing the same physical health outcomes as people in the general population. And that is exactly why taking some time to be part of this conversation is so incredibly important. The New South Wales Government, along with, I'm sure, all of the other governments and agencies that are supporting this work, is really dedicated to ensuring that we are doing what we can to close this gap. There is nothing acceptable about the wide disparity in physical health outcomes that people with mental illness face. That's one of the reasons why we have a dedicated Minister for Mental Health. We want to specifically carve out and call out the specific challenges that people with mental illness face. You know, the reality is, and I'm sure everyone who's worked hard in the mental illness space in this room would know, that in the general sort of massive universe of health, mental illness, and in particular the physical health outcomes of people with mental illness, can become a little bit lost, can become a little bit deprioritised, and creating a dedicated and specific space for that conversation, including through the creation of a Minister for Mental Health, is about saying, as government, we recognise that there are specific challenges that need to be addressed, and that we're very dedicated to creating a platform for that work to happen. In particular, in my portfolio, the fact that as the Minister for Mental Health, I'm also the Minister for Housing and Homelessness, and I'm also the Minister for Youth, is an acknowledgement of the way that those issues are deeply interrelated. There's no accident about the fact that the Minister for Housing and Homelessness and the Minister for Mental Health were grouped together. There is an acknowledgement that we cannot resolve the challenges that we face in homelessness, for example, without seriously addressing what we are doing to treat mental illness in our society. There's no accident about the fact that as Minister for Youth, I was also the Minister for Mental Health, because we know that so much early presentation of chronic mental illness occurs between the ages of 12 and 25, and that dedicated resources for prevention at that age can really make a long-term difference. And if we want to try and move away from just treating the crisis, treating the pointy end, and seriously invest in some of those longer-term drivers that can really make change early and prevent escalated mental health issues, that having someone who's also the Minister for Youth is a really great opportunity to lean into those linkages. So that's a little bit about what the New South Wales government is doing to ensure that these issues are addressed in a comprehensive way. The importance of your work is very clear to the New South Wales government, and we know that we can't do what we can't achieve our full goals in terms of our aspirations without a partnership with you. That is a really clear point that we keep emphasising again and again in our work. The partnership between government and researchers and people with lived experience and their carers is so critical to the work that we want to do to try and make this situation better for people in New South Wales. And I think a great example of that today is going to be the launch of the new resource that the New South Wales government through the Mental Health Commission, and I acknowledge that the New South Wales Mental Health Commissioner, Catherine Lowry, is with us. The new resource that is being launched in collaboration with the Mental Health Commission and Mind Gardens to provide a really clear roadmap for people who are experiencing mental illness to have their physical needs and physical illness issues addressed as well. And Professor Jackie Curtis is here, and she's going to talk about that in more detail, and I'll leave it to the experts to talk with expertise. But it's an example of a piece of work that is very practical, that is very meaningful, that is really intended to make a difference, but that can only exist and be developed through partnerships from the New South Wales government and expert researchers in the space. So it's really exciting to see yet another resource of that type launched and available today. It's really fantastic to have experts like Professor Curtis and others working with the New South Wales government to bring these resources to life, because as we know, it's not just about talking about having these things exist, it's actually bringing them into existence, and none of that is possible without that collaboration and that partnership. I think the power of working together is also something that we're really leaning into in our partnership with organisations like Being, with organisations like the Mental Health Carers, with organisations like the Mental Health Coordinating Council. All of these organisations play an incredibly important and direct role with the New South Wales government in co-designing some of our responses to mental health. The Aboriginal Health and Medical Research Council is also a really important partner, and I understand Matt Trindle, who's the Director of Aboriginal Mental Health at New South Wales Health, is going to speak later today about some of those really important transformative partnerships that the New South Wales Health Aboriginal mental health team have developed alongside the Aboriginal Health and Medical Research Council. So that's just another practical example of that partnerships. It's not just about saying we're for partnerships, which we are, it's about actually demonstrating that with real life work and real life examples. So those are just a couple from the New South Wales government of the kind of examples of that collaboration that we think are really important. It's partnerships with our peak bodies, it's partnerships with our researchers, it's partnerships with people with lived experience, it's also partnerships with other governments. And I think one of the things that the New South Wales government is really committed to is ensuring that those silos that can definitely exist between the states and between the states and the Commonwealth are broken down. And I don't need to tell anyone in this room how frustrating some of those gaps, those overlaps, those duplications, those silos can be. We see it too. And we are really dedicated to trying to work better across the states and with the Commonwealth to ensure that the system operates better for the people who need it. Because of course they couldn't care less what level of government is funding projects or what level of government thinks it's responsible for what, or where a river happens to lie that separates one state from another. The issues of mental illness and its relationship with physical illness, they don't care about state boundaries, they don't care about vertical fiscal imbalance. All of those concepts are completely irrelevant for the people who rely on us getting the service delivery right. And we know that. I mean, it doesn't mean that those issues aren't still challenging. It doesn't mean that there's not still those tensions as we bump up against each other. But I really want to let you know that we see and acknowledge that challenge. And so when we use a kind of buzzword like partnerships, as I said, I don't like to use those words in a kind of meaningless or empty or flippant way. I mean, it's so easy for a politician to get up and say, we care about partnerships. Well, what does that actually mean? Well, it means funding those partnerships with our experts that we've discussed on the ground here in New South Wales, but it also means genuinely spending the time to figure out how to work better with the Commonwealth and how to work better with the other states. So that's how I try and put meat on the bones of those concepts that can be a little bit meaningless if they're just kind of used flippantly. The other partnership that I think is really important is the partnership that we have across agencies in New South Wales. And as I said, I've mentioned the role that I have trying to bring together at least the challenges of housing and homelessness and mental health, but we know that it's broader than that. We know that if we're seriously going to address mental illness in New South Wales, it's not just about housing, for example. It's about what resources are available in our schools. It's about what's happening in our workplaces. Are they structured and designed in a way to promote good mental well-being? You know, it's about what's happening right across government. And so not saying, how do we elevate the issue of mental illness to be a whole of government one within the New South Wales government space? And it's funny because, you know, this symposium even is drawing attention to the fact that even within the health space, sometimes physical and mental health are seen as a little bit separate and are not always, that don't always lean into each other and are not well linked. So I think in a way it's such a powerful reflection of that challenge in that, you know, we have to even create these dedicated spaces for conversations even within health to ensure that physical and mental health are linked, are understood together, are seen as having a relationship. So I think, look, I mean, that's got to be the first nut that we crack in a way, but just an acknowledgement that once we crack that nut or start chipping onto it, the New South Wales government acknowledges that there is so much more that needs to be done, even within our government, to ensure that people with mental illness have good physical health outcomes, but they have sort of good broader social, economic and community outcomes as well. And so always really willing to be part of conversations that lean into that issue as well. Look, finally, I think I just want to say the New South Wales government is serious about improving mental health and we want to work with you to achieve that goal. People with a mental illness have every right to have the same opportunities to access healthcare as everyone else. And we all know that something that Australians like to talk about and are very proud of is the fact that we have universal healthcare in this country. We like, you know, it's one of our aspirations that it doesn't matter what your income is, you have access to quality healthcare. I mean, we know that that's not true across the board, and it is most profoundly not true in mental health. That is the area where that gap between people who have access to resources and people who do not, in terms of the quality of their health outcomes, is the most significant. So when we talk about our aspiration to have universal healthcare, it doesn't matter how much money you have. you are able to access the best quality healthcare. When we talk about that as our aspiration, and we talk about the fact that we're not nearly there yet, the biggest ground that we have to make up is in mental health. And it is simply unacceptable to me that when you see someone who is struggling with mental illness, whether it's trying to navigate the system, whether it's trying to get the best treatment, whether it's trying to get access to innovative support, whether it's trying to have coordinated support for their physical health, their housing, all of those issues, whether or not you have money is a profoundly significant indicator of how well that is going to go for you. And to me, that's not okay. That's not acceptable. And addressing that gap is something that is very important to me, to everyone in this room. We seek to fund initiatives to resolve that. We seek to lean into people who have ideas about how we can address that significant imbalance. Those are the conversations that we're really keen to have. Those are the initiatives that we want to hear about. Those are the ideas that we want put in front of us. That disparity is something that drives my work in this space every day. And I know that so many people in this room have ideas and research and suggestions and lived experience that speak to that and seek to resolve that. And I'm all ears. Good luck for the conversation. Thank you for taking the time to be part of it. And we're really keen to and proud to support your work. Thank you.